Hello guys, a great afternoon to all of you, and myself, Dr. Subhagya here. Like today, a public health dentist. Today, I'll be teaching you about basic need of health informations and basic medical statistics. Why this topic has been taken? We should remember something in the form of an idiom. Exactly as a general rule, the most successful man in life is the man who has the best information. If we have the best information, we are the best and the successful one in the entire globe. What is health information basically? It can be defined as a mechanism for the collection, processing, analysis, and transmission of information required for organizing and operating health services, also for research and training. So, this is a very great and important point for us to know. Now, the primary objective of a health information system is to provide reliable, relevant, up to date, adequate, timely, and reasonably complete information for health managers at all levels, be it the central, intermediate, and local, and sharing of technical and scientific information by all health personnel participating in the health services of a country. And also to provide a periodic intervals data that will show the general performance of the health services and to assist planner in studying their current functioning and trends in demand and workload. Unfortunately, it is still very difficult to get the information where it matters the most. So let me explain you the few striking difference between a data and a information. Okay, so can we can think about it for a moment, but let me just sum it up for also. Data consists of a discrete observation of attributes or events that carry little meaning when considered alone. Data as collected from the operating healthcare system or institution are inadequate for planning. So data need to be transformed into information by reducing them, summarizing them, and adjusting them for variations such as age, sex, composition of the population, so that comparison over time and place are possible. And it is a transformation of information through integration and processing with experience and perception based on social and political values that produces intelligence. That is very important for us. So let me tell you, data are simply discrete points, which is again processed and transformed into information, as a result of which, when information is again variably adjusted in terms of social, political values, their intelligence. Data that are not transferred to information, and information that is not transferred to intelligence, to guide decision makers, policymakers, and planners, administrators, and healthcare personnel themselves are of little value. That's the most important thing. So if you want to add a value added to the data, then we must be very much clear that it has to be transferred into information, and the information has to be converted to intelligence for the betterment of the public. This is what is data, information, and intelligence are taken into consideration. Okay. Now, what are the requirements to be satisfied by health information system? That is very important. So that counts exactly, because in this way we are going to solve the public health problems exactly. So it is like the system should be population based. The system should avoid unnecessary collection of data. Okay, and the system should employ functional operational terms. System should express information briefly and imaginatively. The system should provision for the feedback of data. So these things are very important and very vague type to remember. But let me clarify it to out that how it helps. So first of all, the cohort should be population based. Why it should be population based? So that we can uh, get some generalized information, generalized intelligence we can develop for prevention and control of disease at the population level. And the system should be avoid unnecessary collection of data. What happens many times, we got various source of data. Sometimes rumors can be thought of being a data, but that's not always correct. You need to separate a data from a rumor and information and then convert it into intelligence. So should have, like, operational terms and conditions in which there should be definition should be clear. what is the illness data, what data is required for treating, I mean, capture the population for the betterment. So these things have need to be taken into care. So we should have like indicators basically for that. So we should understand that demography and vital events are indicators, environmental health statistic, health status, health resources, utilization and non-utilization of health services, indices of outcome of medical care, financial statistics. So these things are very much required to understand that our health information system working or not. Like first we need to understand in terms of disease data, surveillance data, information data. I mean, try to eradicate or control the disease, and then moreover into it, that is the medical care properly utilizes, are the indices properly attributed, and then financial statistics, are the financial goals achieved, is the cost benefit ratio achieved or not with that. These things helps us in totally. I mean, these are the basic components of health information system, and this proved to be very important for this moment. So these things are important. So we need to understand that in terms of understanding health information and basic medical statistics. And if informations are correct, and we have got some data which is converted into intelligence, then I think things goes well, and we can achieve the most important thing in life. Okay, that is your planning a solution for the health problem. This is very important for us to understand. And in case of any doubt, please do connect with us. These are basically for the planners in the government sector or the company level, or those who want to plan the health system, basically for the betterment of the public. As an independent planner, I suggest that data collection, there should be a robust data mechanism to understand things well, and that goes well if academics are proper in this way. Thank you so much.